guys, it's gonna be a quick video. As you guys can see, I am at work right now, but I can't help but notice that I have friends here on YouTube that are aspiring phlebotomists, or they're already phlebotomists. It's just that they're new. They're asking me questions about how they're gonna be able to figure out what colored tubes some tests go to. Yeah, it will take a while for you guys to memorize where all these tests goes into, but you guys just have to know that there's 3 main benches in the lab. Most of the time, it just depends on where you work. There is hematology, chemistry, and coagulation. So usually it wouldn't be a problem for you guys to figure out where the test goes into, like what tube, because it is usually like if you don't know on top of your head where it goes, you can always ask somebody. That's the first thing you can do. And also you can always go online. Don't go to like Google or something, although Google will give you the correct answer most of the time, but every company or every lab is different as far as their protocols and how they collect and process their blood. I work for a lab in Washington, and so this is how we do our testing. Okay, so where I work at, we have labels that print right here. I'd have to like block the information, but obviously, okay, so here is the label that we print out. You see the patient's name and personal information is going to go here. This is their sample number, their medical record number. But you see that the test right here is a CBC. CBC is a hematology testing, and as you can see right here, it'll tell you that this test goes on a lavender tube. Now, lavender tube comes in different shades, but they all go in a tube that goes like this, or it can go in a tube that's darker colored, darker purple. Okay. So here is another test for that patient. As you can see, it tells you what test it is. It's cyclosporin. This is not one of those things that you see every day. Depends on where you work at, of course. Sorry, my phone has to focus. Yeah. So it tells you that it goes in a lavender tube and it has to be in a room temperature environment. So clearly, you shouldn't be refrigerating this. So if you guys have labels that tells you what tube the test goes into and what the process is, then you lucked out, because it just made it a whole lot easier for you guys to figure out, the tubes that the test could go into. Okay, so this is called an order requisition from the doctor. You guys would probably see this. It is a Labcorp requisition. I'm going to show you guys a picture of it around here, but I folded it this way just so you guys don't see the patient's information. But here it'll tell you all of these tests right here: acute hepatitis panel, basic metabolic, comprehensive metabolic. All these right here are tests. All these right here are test codes. And all of these right here are the color gel that you guys need for these tests. Okay, CMP, okay, it says 14 here because there's 14 different things that they check, and it goes into a gel separator tube. That is either a tiger top, a gold top, or a mint top. And for this one, as you can see right here, kidney profile, these are test codes as well. It goes in a gel separator tube, which is, like I said, gold, tiger top, And it also need, for this profile, they might be checking your urine sample as well. So they do need a urine from you, and it should be in a sterile urine cup. This one is a special test right here, lipid cascade. It says C reverse. So let's see. Lipid cascade. Let's see. See, here's more information about that test. It goes in a gel and NMR lipo tube. So I'm gonna show you guys what NMR lipo tube looks like. NMR lipo tube looks like this. There you go. It has a gel separator. So here's the NMR lipo tube. I call it the bumblebee tube because it's black and yellow. And this is a special kind of cholesterol test here. So there's this gel right here. And yeah, this is where NMR testing goes. So like I said, it'll tell you, it'll tell you right here, NMR. All right, let's go to hematology. So in hematology, just try to remember all of these, most of these goes in a lavender tube, okay? All right, these are other tests as well. This, like I said, is blood typing. It goes in a lavender tube, and this one is special though, okay? Because this one doesn't go in a regular short purple tube like that. It doesn't go on that. It goes on. Okay, so when you are drawing for blood typing or the blood bank, focus, it goes on a pink top tube like this. The thing with this is that, all right, there you go. The thing with this is that it has the same additive as the lavender tubes over there. It has EDTA. It has 10.8 milligrams of EDTA, I believe. And this one, how much? 5.4 milligrams, so double it. So this and this are just the same, it's just a little bigger. And this is the tube that you use to collect blood samples for blood typing or blood bank. Again, I'm telling you guys, it might be different from how we do it here. Always check with your company's protocol. All right, so A1C, lavender top, and all of these. See, a lot of testing goes into the gold top. Quantiferin, this is the TB test right here. It says kit. You guys should have a quantiferin kit. It looks quantiferin kit looks like this. There's 4 tubes in there, and I don't work for Labcorp, but that's a very big lab and they're all over the world. In each tube you have to put around 1 milliliter of blood in there. If you guys have any other questions about this kit, just shoot me a message and I'll try my best to get to you. What else? So you can see right here, PT and PTT. These and these, they're the most common coagulation testing. And so it'll tell you that it goes in a blue top tube right here. See, it's pretty easy. These are all micro testing. I don't usually do this, but I know that these probably goes in like a swab or something, and this one in it'll tell you what toolkit it goes into. Yeah, and also these things right here are extra testing. It won't tell you what kind of tubes it goes into, and that is when you go on the internet and ask Mr. Internet what to do. This is a Labcorp requisition. As you can see, you have to go to labcorp.com and figure out what's their specimen requirements. Let's go. Okay guys, so here is the Labcorp website right here. Where you're gonna go to test menu, okay, and scroll. Alright, and here you could either use a test code or a test name or something. We are gonna try to see what do we need, what color tubes do we need to go test for potassium. Okay, see, take note, there is a regular potassium. It's called serum. It needs the sample that it needs is just a serum or plasma. They can also test for your potassium level through a 24-hour urine collection, but we are trying to figure out the tubes, right? So we're gonna click on that, and then it'll tell you everything that you need. Expected turnaround time. They will get the results within 24 to 48 hours. That's what I always say. So serum or plasma, okay? They only need serum and plasma. They only need about 1 milliliter of that. And if the patient's a hard stick, you can go ahead and draw 0.7 milliliters, but that is all the test they can run, just the potassium. They cannot run anything else. Okay, and here is where you're gonna see what they need. They can either use a red top tube, a gel barrier tube, or the gel separator tube, the green top, the mint top, because it has lithium and heparin in it. And it tells you what not to use here. It also tells you how to collect it right here. So basically it's just telling you that once you collect it, you wait half an hour and then spin the blood, and then it's all good after that. You have to refrigerate or put it in room temperature. It'll also tell you how long the sample's good for in different temperatures. It's good for basically 2 weeks, whichever temperature it's in. And freeze thaw cycles, it's stable ×3. And it'll also tell you why they would reject the sample, even if you drew it into a gold top tube. Even if you drew it in the correct tube, they're gonna reject it if the blood sample is hemolyzed, if it's not labeled correctly, or if you did not spin the sample. And there's a lot more information here, and yeah, you can see everything here. Like I said, if you work for Labcorp, go to the Labcorp website, because you gotta follow their rules and regulations and protocols. I do not work for Labcorp. There's Quest Diagnostics, there's Kaiser Permanente. So yeah, what I'm saying is that there's a lot of different labs around the world, around here in the States. So you do not just search Google what the protocols are, because Google probably will not give you the correct answer unless you're very specific. I went to Labcorp because that's just an example. There's a lot of other websites that you can go to, or a lot of companies that you can go to. Like I said, there's Quest Diagnostics, there's Kaiser, there's Everett Clinic, there's Providence, there's a whole bunch of other labs, and they might have different protocols and rules from each other. My work, we do things differently, and yeah. So that is it for this quick video, guys. I hope you guys learned something, I guess, and I hope that I answered some of your questions if you guys have any. Okay, so I got cut off there, but if you guys have any other questions about phlebotomy or anything like that, I know I don't work that much anymore, but I still am kind of knowledgeable with things around the lab. I believe I have been doing this for about 13 years now. So if you guys have any other questions, guys, just hit me up. It might take a while for me to upload a video just because life is busy, mom life specifically, but I will try my best to answer you guys. Don't forget to follow, like, and subscribe, and I will see you guys later. You guys take care. Bye.